Hello and welcome to the training on the picture guide to the medical exam after sexual assault. My name is Amy and I am the Disabilities Grant Coordinator at the Sexual Violence Center. Before we get started, it is helpful to have a guide with you while you view this training. If you do not have a guide, please pause and ask staff or another advocate where they are. If you're watching this in the crisis unit of the Minneapolis office, you should be able to find printed copies of the guide in the crisis unit. If you're unable to find a printed copy, you can hover over the copy of the guide that is on this website by this training, and in the upper right-hand corner, there should be a box with an arrow. Click on that box and it will open a copy of the guide in a new tab. You're able to print from that tab, and if you're somewhere where you don't have access to a printer, you can close out of the tab, and then on the site where you're watching this training, just scroll along through the guide on the site itself. But I would suggest trying to have a physical copy with you because I think it will be easier to read and easier to use. Our learning objectives of this training are that you will understand how the picture guide to the exam after sexual assault can support a victim survivor. You'll understand that all parts of an exam are optional, and understand that victim survivors with disabilities have the right to make decisions about the exam. First, let me tell you about the program that brought this guide together. Accessing Safety in Hennepin County is a collaboration between the ARC Minnesota and the Sexual Violence Center. The mission of the collaboration is to improve how both agencies support victim survivors with intellectual and developmental disabilities. The two agencies will work together to provide services that respect and empower victim survivors. Accessing Safety in Hennepin County will help victim survivors get the skills and resources they need to heal. Let's talk for a second about your role as an advocate. This is very important, and you might recognize some of this information from other trainings that you've done. Our role is always to be victim survivor centered. We do this by providing support and validation, offering options and letting the victim survivor decide what to do next, and advocating for the person and what that person wants whenever possible. Make sure that the victim survivor's voice is heard and prioritized, even when working with guardians, parents, family members, social workers, doctors, nurses, and other professionals. Also, it is not your role to decide if a person has the capacity to consent. Sometimes we wrongly assume that a person was assaulted because they have a disability, and that might not be correct. Listen to the person. Keep in mind, we are not the legal experts, and the laws about sexual consent for people with intellectual and developmental disabilities are confusing and unclear. This picture guide was developed with the intention of being a tool for people with intellectual and/or developmental disabilities. It is important for you to know that this guide can be used to explain the exam to any victim survivor. This guide is created to be as inclusive as possible, which means it is written in words that are easy to understand, with pictures to support the topic, and includes considerations for people with disabilities, such as explaining that assistive devices might be checked for evidence. Always remember, victim survivors are in control of the exam. They should be empowered to make informed decisions within the advocacy relationship. The exam can create a lot of stress, fear, and sometimes additional trauma for victim survivors with disabilities. Use this guide to help explain what will happen, unless the victim survivor does not want to use it. It is always their choice. Victim survivors with disabilities may have a guardian with the legal power to make medical decisions. However, this exam is considered to be an emergency medical service. Decisions about the exam rest with the victim survivor. That said, hospitals have their own policies and procedures to follow and may require consent from guardians before an exam. As with any victim survivor, it is our role to tell people about their rights. While it is ultimately the nurse's decision if they need guardianship consent, we can advocate for the rights of the victim survivor to access the exam. It is important to support the victim survivor in their decision about who to have in the room during the exam. This includes a guardian or a caregiver if the victim survivor chooses to ask them to leave the room. The victim survivor may not have had access to reproductive health care in the past, and this exam and evidence collection process might be the first experience with this sort of care. You can either give the picture guide to the victim survivor to read themselves, or offer to go through the guide together. It is your responsibility as an advocate to empower the victim survivor at every step. This includes allowing the victim survivor to decide if they want to use the picture guide or not. As an SVC advocate, you will be familiar with the forensic evidence collection kit process. The one shown in the guide may vary from your personal experience. Please adapt as needed when you provide medical advocacy services. For advocates not familiar with the process, we are hopeful this information will better prepare you when working with a victim survivor during a medical advocacy. This training is brief because the best way for you to know how to explain this guide is to look through it yourself. We have one more slide, and then I encourage you to read the guide. Notice how often it repeats that the victim survivor gets to decide what happens during an exam. When reviewing, do you notice any parts that seem different from recent exams you've been on? It's possible that some of the steps have changed. You can always adapt how you explain and use this guide with victim survivors based on your own knowledge and experience as an advocate. So, just to summarize some of the points that were made during this training, you can use this guide to support any victim survivor, even if they don't have a disability. All parts of an exam are optional, and victim survivors with disabilities have the right to make decisions about the exam. If you have any more questions, feel free to ask an SVC staff member.